Every morning, 7 days a week, state and county health departments release tons of data on coronavirus, case numbers, deaths, hospitalizations, and that data changes quickly. And unfortunately, misinformation can follow just as fast. Data expert Garrett Archer and investigator Melissa Blasius looking into two of the most common rumors on social media about coronavirus in Arizona.
The claim, Arizonans who are suspected to have COVID-19 and have died in recent months have all been marked as COVID-19 deaths, even if they did not die from the virus. It's a myth that originates with the Federal CARES Act. That's an aid package passed by Congress back in March, which increases payouts from Medicare to hospitals for COVID-19 treatments, from around $5,000 for a typical stay to $13,000. That's when internet speculation began popping up that hospitals were erroneously coding patients for COVID-19 to take advantage of the higher payouts. The rumor picked up steam just recently when it was found that a man who died in a motorcycle accident in Florida was initially marked as a COVID-19 death. We asked Dr. Kara Christ, head of the Arizona Department of Health Services, how COVID-19 deaths are counted and who's responsible for marking someone as a COVID death.
That's the physician on record as being the treating physician or the physician that witnessed the death.
So ultimately, it's doctors, not the hospital, that certify a COVID-19 death, and they have no financial incentive to determine a death is from COVID-19. People who say that doctors are certifying nearly everything as COVID-19 deaths are trying to make the argument that death numbers in Arizona are inflated, that the number of people who have died in Arizona this year amounts to a bad flu season. This is also false. Health Department death statistics for the months of January to June 2020 show 34,457 deaths in Arizona so far this year. A year ago, in 2019, it was 30,522 deaths. That's a 12% increase, almost 4,000 more deaths. The next closest comparison from the past 10 years is 2015 to 2016, with a gap of 1,800 deaths, half that number. Finally, we asked Dr. Christ about that motorcyclist's death. Her response was clear.
So if somebody is COVID-19 positive and is in a car accident that has nothing to do with the COVID, they are not going to be counted in the COVID numbers.
With data analyst Garrett Archer, I'm Melissa Blasius, ABC 15 Arizona.